Yes, welcome back to the program here until midnight tonight. Plenty to talk about. Bettina Arndt will be on the program a bit later on. And we'll also be asking the question why Girl Babe is winning the battle for survival. That's coming up a bit later on. But first, we're going to talk to mental health expert Bettina Stangon with regard to an issue that's very real in society, and a noted actress has come out and spoken about it, and we're going to discuss that with Bettina. Welcome to the program.
Thanks so much for having me.
Now, do I refer to you as doctor?
No, I'm a psychotherapist, not a doctor.
No, that's all right. Well, look, this is a really big issue. You might like to background what we're going to talk about tonight for those folk that have just tuned into the program.
Sure. We're going to be talking about bipolar, and Jessica Murray having come out and actually spoken about her own management of her bipolar and her lifestyle.
Which is quite... I had a gentleman on last hour who'd had a lot of issues with depression and battling depression throughout his life. Where does bipolar or depression cross over to bipolar, or are they unrelated?
No, they're not unrelated. Depression is really an aspect of bipolar. So bipolar is predominantly a set of mood swing conditions, and depression really is at the bottom of that swing, and anxiety or mania is right at the top of that swing. So, depression is very much a part of the set of behaviours that we put under that bipolar kind of heading.
If somebody is suffering depression, does it necessarily mean that they could possibly end up suffering from bipolar disorder?
Yeah, that's a difficult one, really. You need to look at quite a big picture to be able to finally diagnose bipolar, which is why it's often quite late in diagnosis. Somebody might present with depression, and there's a lot of people sort of self-diagnosing with depression, and mostly that's because they're not happy, and they're not happy for an extended period of time, to put it really, really simply. But once, as a therapist, once you've known somebody or worked with somebody for a little while, and you notice that it's not predominantly depression, that actually over time then maybe hypervigilance, anxiety, or even stemming up into what we refer to as mania, then you can start to say, okay, there might be a pattern here, but it's really only with that extra information that you can diagnose bipolar.
With regard to both depression and bipolar, this may be something that you may not feel comfortable answering, but I'm going to ask you and you can tell me.
Oh.
Is it necessarily genetic?
Massive genetic component, so about 80% genetic component, and then the rest can be activated by an event. There's two types of bipolar, so type 1 and type 2. Type 1 is pretty evenly distributed between men and women. You know, they experience it the same. Type 2 is frequently experienced more commonly in women than men, and it can be very often set off after you've had a baby, when you're going through those teenage years, very hormonally influenced. There is a very big genetic component to it.
How do you determine between type 1 and type 2, I think you described it?
Yeah, so type 1 has the extra added bonus, shall we say, of usually mania and psychotic episodes. And that doesn't mean lots of manic episodes. It means you may only have one in your entire life, but it can go on, but you may have many, so it really does depend.
When you talk about a manic episode, are you talking about an anxiety attack or something like that?
It can start with anxiety. It starts usually with hypervigilance in a particular area, which at its baseline is anxiety, but then it goes into what is generally referred to as chemically enhanced, that biochemical component, which can send you into mania, so it's a very heightened level of hypervigilance, and then into a psychotic episode where, you're not of sound mind, you may be fixated, you've lost sight of reality, and it can be different depending on who you are and how you're experiencing it.
And we're talking about bipolar here, and that's type 1, is that the way you describe that?
That's right, yeah.
And what about
most severe?
As opposed to type 2, which is less severe, is it?
That's right, yeah. So type 2, which, I don't know Jessica Murray, and I'm certainly not her clinician, but type 2 is more commonly where people can manage it with lifestyle and certainly with the support of a GP or a psychiatrist, but they may never experience any mania, or they may have hypomanic episodes where they're hypervigilant. I've got clients who get up in the middle of the night and alphabetise their pantry, for example, and reorganise the linen cupboard and need everything to be meticulous, but they're no harm to themselves or anybody else. And they may have those periods on and off every few months, or maybe only once a year. And it's frustrating. It interrupts their sleep-wake cycle, but it certainly can be managed.
Bettina Stang on is my special guest, who is a mental health expert. We're talking about the various forms of bipolar. I guess by Jessica Murray coming out and talking about her issue with bipolar, and do we know whether she's one or two out of interest?
I don't.
No.
Yeah.
Well, I guess it's good because it brings it out and it starts the conversation with regard to this disorder, and therefore, I guess, would I be correct in suggesting it's destigmatised a little more?
One would really hope so, wouldn't you, John? I mean, a lot of people are living with it, and actually, it's wonderful for people like Jessica Murray to come out because, there's a lot of high-profile, really inspiring people that have bipolar. Stephen Fry has bipolar. Robbie Williams has bipolar. I believe Andrew Johns came out and has bipolar. Richard Dreyfuss, Spike Milligan, Carrie Fisher. All really inspiring, creative people who have managed it, and certainly all those people I've mentioned have had different experiences themselves with bipolar, but it is able to be managed. You can go on to have a successful, integrated life, have families, have children, have loved ones in your lives. It's not a sentence where you can't integrate yourself into society and whatever normal refers to for you lifestyle.
I think with mental health generally, we were talking about Men's Mental Health Week kicking off tomorrow till the 15th. Mm-hmm. It's an issue that people don't know how to handle it when somebody says, I'm depressed, or they have an issue, whether it be a man or a woman, and many run away from it because they've never heard of it, never read anything about it, and it's quite confronting for them. But if we talk about it, I guess it helps the community deal with that situation should it arise in their own personal space.
That's absolutely right. And to have more information, as you say, for more people to be talking about it and understand, I think bipolar, which used to be called manic depression, which
yes.
Which kind of evokes a bit more of that kind of, oh my God, they must be mad type of feeling, that there's really something wrong. And the truth is, yes, the way that people with bipolar's brain functions, and that genetic component is certainly there, is different from somebody who's not experiencing depression or anxiety or anything in between. But for me, the more people that understand it, that can understand that this is okay, we can manage this, let's get a diagnosis, let's monitor it. It really doesn't need to be as severe. As I say, type 1, if there is that type of psychotic element, then definitely medication is something that needs to be considered and discussed with a medical professional. But it can be managed, and you can manage it for the rest of your life and carry on having a fantastic life. A
couple of questions here. In terms of, I guess, depression and bipolar, can you be going along very, very well, and if you have a number of issues, if you are predisposed to either, it tips you into depression, or likewise it can tip you into that bipolar disorder?
That's exactly right. In my business at Nursery Confidential, we have a residential program, and usually exactly what you're talking about, an event has tipped people into something which is at the extreme end of the spectrum. So let's talk about depression. Yes, there is a genetic component, but it frequently gets activated by an event. So I get fired, or there's a death in the family or an illness, for example, and I'm struggling to feel better, then absolutely I can start to need support and need to look at my lifestyle again in order to assess, am I heading into depression? And actually the management of depression or anxiety or bipolar is, the key word really is management and understanding yourself and starting to be able to monitor your moods and your lifestyle and what you eat and whether you're sleeping well, so that you don't actually tip into one of the extreme ends of that spectrum. But yes, the short answer is absolutely. An event can tip you into an episode, is what we refer to as an episode with bipolar, or into a depressive episode.
And tell me, how do you diagnose depression as opposed to someone suffering from either type 1 or type 2 bipolar? Or is it something you can diagnose now by talking to them or consulting with them, or is it something that takes time to diagnose?
Depression is probably more readily diagnosed than bipolar, so simply because people will present and talk with you about how they're feeling at the moment and in their most recent history. So as I said before, with bipolar, it might take longer for me to be able to get a full picture, because I might need to see you, or you might need to become aware of the fact that you may feel depressed now and you may have been feeling depressed for a couple of weeks or maybe even months. But do you also then come out of it and become hypervigilant and go into that manic mindset, or do you go into an anxious type mindset? I mean, all of us experience levels of anxiety and even levels of depression, even, all of us kind of so-called normal people. But the truth is that it's harder to diagnose because you need a bigger picture. I often say to people, and if you're even concerned that might be the case, I had a case of a lady whose father, she knew her father was bipolar, but undiagnosed. She was starting to question some of her response postnatally, and we just said, let's just monitor it. Let's start to notice how you are premenstrually, what your moods are like when you go into that hypervigilance. Let's just start to track it, and then we'll be able to get a bigger picture before we go into that diagnosis phase.
So if that person is in a depressive state and maybe taking medication, if they're having huge mood swings, whether it's premenstrually or whether they're anxious, does that necessarily suggest that it's more severe depression or moving into the phase of being either one or type 2 or type 1 bipolar?
Yeah. So if they were already medicated, you would want to assess the medication, because unfortunately a lot of medication and even antipsychotic medication can have side effects, which until you've kind of assessed what the side effects are, it's hard to tell. And that's not my area. I'm not a psychiatrist, so I would always refer over and say, look, you're on this medication, let's have a look at that first. But yeah, I mean, you can go into a severe depression and then, ironically, in your attempts to come out of a severe depression, let's say, I mean, that's really noted by starting to get moving, starting to set goals, starting to move forward with your life rather than in that why bother mentality of, I don't want to do anything. And that can quite easily, particularly if you've got that predisposition to bipolar, head you into, I have to make things happen, I have to make it happen now, and you become very directed. And if that goes into hypervigilance and mania, then obviously
I think I might have lost Bettina. We'll just check that mobile. It's gone a bit funny. Bettina Stangon is my special guest, and we're talking about the issues associated with the condition bipolar. This is News Talk 4BC. A quick break and we'll come back. I'm talking with Bettina Stangon, who is a mental health expert, and we're talking about bipolar and how it's diagnosed. From where I'm sitting, Bettina, is it difficult to diagnose? It seems the waters are a little muddy around whether somebody has depression or bipolar.
Look, John, you're right. The waters are a little bit muddy, and that's, it'd be wonderful if there was a blood test you could take and say, yep, there it is, it's bipolar, but there just isn't. And the truth is that we need to get a clearer picture, and often time can help. I mean, it's very clear when somebody's having a psychotic episode, but unfortunately a psychotic episode can be brought on by other things. So, if somebody presents with the psychotic episode, and usually that's because they've been hospitalised, it could have been brought on by drugs, it could have been brought on by having taken other pharmaceutical medications and having a reaction to that. So it is a difficult thing to diagnose, and it's why there is that blurry line where it can be missed. And that's not necessarily because the professional that missed it isn't adequate at their job. It's just because it's difficult to link up things sometimes.
There are some people that want things done yesterday, but is that a marker for what we're discussing?
people wanting things done
Yeah,
yesterday.
in other words, a shotgun approach to life.
Yeah, look, I would absolutely agree with you. Certainly, I mean, I guess I'm saying the same as you. I'm an advocate for being self-aware and monitoring it, and if you can do that with the supervision of a great doctor or a great counsellor or psychologist, then that's helpful, and then eventually you might get a bigger picture of how you tend to function. And like we mentioned earlier, it may also have a hormonal component. We certainly address that in my program. So you can look at your lifestyle as a whole, but it's not, you can't walk in and say, am I bipolar, and expect a professional to go, yes, bingo, you're bipolar, unless you've got a really good understanding of yourself and you can say, look, I've noticed over the last month, 6 months, year, last couple of years that I have these episodes, or I have a predisposition to responding to life this way, and then we'll be able to see the pattern.
So there's so much to take into account. I mean, you've just thrown another one into the mix there, hormones, lifestyle, if it's a busy lifestyle. There's a whole host of issues in there that make the diagnosis, I guess, a little more difficult.
Absolutely, absolutely. Like I said, women with type 2 are more common than men. Postnatal can activate it. Going through that hormonal phase as a teenager can activate it and exacerbate it. And then if you add in particularly those teenage years, experiments.
What about heading into menopause?
Absolutely, absolutely. Big hormonal changes. And there are tests, biochemicals you can test, histamine levels that you can test, but nothing will give you that glaring, there you go, that's the answer. You need to link up lots of different things to be able to give a definite diagnosis. But
I guess by people speaking out, and particularly this high-profile actress coming out and suggesting that she's suffered, it gives people the licence to be able to admit, without any stigma.
I hope so.
As to their condition. Is it always medicated?
No, not at all. Look, type 1 is definitely medicated, particularly if you're having psychotic episodes. Type 2, no. I believe Jessica Murray has come out and said she chooses not to medicate. She uses CBT, so cognitive behavioural therapy, and a lifestyle approach. She mentioned that she has amazing support from her husband, which certainly makes a massive difference, particularly when you've got a small child like she has. So, because postnatal is a bit of a dangerous time if you've got a predisposition to bipolar. And
I believe many who go through that period do suffer and don't know, and it's years later that they're diagnosed.
Absolutely, yeah, in hindsight.
Yeah, so I spoke to a gentleman who really battled depression last hour and has now beaten it because of lifestyle and the environment in which he lives now. Is this the case with bipolar? Is it something, I want to use the terminology that you get over it, but do you ever?
You don't get over it, you learn to manage it. For me, type 2 bipolar, the way that we approach it in my residential program is to say that this is to get information about how you function. So biochemically, genetically, hormonally, behaviourally, mindset-wise, and we look at it by saying, okay, we take away all the stimulants, caffeine and sugar, and we look at gut health, we look at your sleep-wake cycle, we look at your mindset and teach you mindfulness so you can manage it that way, CBT and mindfulness. We give you supplements and make sure that you really have such a clear understanding of how you function, how you do bipolar, for want of a better word, so that you've got that insight into yourself. You know when you may be vulnerable to heading into a depression or heading up to a mania. And if you can monitor it that way and have a great support system, then it is certainly possible to not medicate.
Wouldn't that work also for people suffering depression?
Absolutely. I mean, that's what we treat predominantly in my program, and the success rate is exceptional.
So tell me about your program and where we can access it if we should need to.
Sure. My business is called Noosa Confidential. It's a private residential mental health program.
Sorry, it's a bit fast for my old ears. What was that?
Sorry. It's called Noosa Confidential. It's a private residential mental health program in Queensland, in Noosa. The website is noosaconfidential.com.au, and we approach mental health from an integrated angle. So we have.
It sounds like more of a holistic point of view, is it?
It is, but it's a science-based holistic approach. Okay. So we have residential doctors as well as counsellors and naturopaths, etc. So we really treat the big picture.
Look, it's most interesting talking with you. Thank you for coming onto the radio and sharing your vast array of knowledge with us.
Thank you so much for having me again, John.
Yeah, all right. Nice talking with you. That's Petrina Stagon, who, as you said, as you heard her say, is from Noosa Confidential. It's noosaconfidential.com.au if you want to talk or want to find out more about her business, and she is a mental health expert.